You have the floor.
Merci. Thank you. I'd like to thank the committee for inviting us. It's a pleasure to be here today to speak to you on a number of issues. I primarily today will focus most of my comments on Bill C-83. And I've also submitted some briefs at the request of the committee around prison needle exchange, as well as, sorry, the other ones escaped me already, the high-risk women offenders proposal that we tabled back in 2005. But I'll stick to C-83 and certainly open to any kind of questions that we may have afterwards. So the Union of Canadian Correctional Officers, we represent over 7,300 federal correctional officers working in all institutions across the country. As law enforcement professionals, we represent a critical component of the Correctional Service of Canada, enabling the service to achieve its public safety mandate 24 hours a day, 365 days a year. Recently, there has been much consideration given to the role segregation plays within Canada's correctional system, both provincially and federally. It has been thoroughly studied, its effects analyzed and debated both by academics and by critics of justice systems globally. With the recent introduction of Bill C-83, CSC will be forced to significantly change the manner in which it manages its offender populations. The passage of Bill C-83 will result in changes to operational policies that will markedly affect the operations of our federal penitentiaries, impacting staff and inmates alike. Accordingly, UCCO SACC CSN, whose members represent a significant partner in the discharge of effective corrections, seeks to participate in the discussions about these changes. As such, the goal of this report is to provide perspective on the potential impact of these changes from a correctional officer's perspective. Should Bill C-83 be successful, CSC will be forced to implement policy which will drastically alter the manner in which the most difficult segments of its population are managed. As we've seen through recent CSC policy changes to CD 709, by eliminating segregation and replacing it with structured intervention units, CSC will further struggle to achieve its mandate of exercising safe, secure, and humane control over its inmate populations. We are concerned about policy revisions that appear to be reducing the ability to isolate an inmate either for their safety or for the safety of staff, Section 37.3. This is not to suggest that Bill C-83 is not without its merits. Tools such as body scanners provided for in Bill C-83 will enhance correctional officers' abilities to reduce the various types of contraband that threaten the safety of those working and living in federal institutions. However, in order to implement the bill in its entirety, there will be a much greater commitment required from the federal government to ensure its success. While the bill seeks to amend several key components of the CSC framework, perhaps the most significant in relation to security operations is the elimination of segregation units within federal institutions. While UCCO SACC CSN recognizes that the effective corrections requires the ability to adapt, our members are also tasked with ensuring safety and security of all offenders and staff in our institutions. By eliminating disciplinary and administrative segregation, the ability to maintain control over diverse populations will be significantly impacted. We accept that an over-reliance on segregation as a disciplinary consequence may lead to negative outcomes. However, there are instances where swift and immediate responses to dangerous behavior is a necessary option. In 2017, we witnessed the unintended impact of changes to correctional policy, namely CD 709, administrative segregation, and CD 843, the interventions to preserve life and prevent serious bodily harm. These policies significantly reduce CSC's ability to manage its institutions through the use of segregation. Although well-intended, this quickly led to a sharp increase in violence within federal penitentiaries. Early data released through the Office of the Correctional Investigator on the impact of these amendments provided some indication of the operational outcomes of these changes. An analysis of the numbers found a clear correlation between release back into regular population and violent incidents. The releases declined to 4,025 from 5,501 from 2012 to 2017, while the number of those leaving segregation who were implicated in assault rose to 321 from 244. Furthermore, correctional investigator Ivan Zinger stated that the new strategy to limit prolonged segregation has had the unintended consequences of more violent attacks behind bars, and that he's urging the Correctional Service of Canada to strengthen and risk assessments to improve safety for inmates. While Mr. Zinger may suggest that these changes led to unintended consequences, UCCO SACC CSN has been unequivocal in its position that this outcome would occur. In the last 2 years, we have seen institutions that, despite shrinking populations, are becoming more violent due to organizational repose that reduced control measures, which appeared to be correlated further with increases in assaults. While UCCO SACC CSN does not advocate for unnecessary segregation of inmates, it does strive to ensure its continued availability as a population management tool, without unreasonable policy-based restrictions or outright elimination. Consideration also needs to be given to the transitional nature of Bill C-83. Should this bill be implemented, all inmates who are subject to disciplinary segregation will no longer be the subject of this sanction, sections 39 and 40. This will result in immediate changes to the management of violent offenders in institutional populations without apparent consideration for how they will be managed moving forward. The bill seeks to replace segregation with the implementation of structured intervention units, the details of which are still vague. This bill would allow the Commissioner to designate a penitentiary or an area in a penitentiary as a structured intervention unit for the confinement of inmates who cannot be maintained in the mainstream inmate population for security or other reasons. Section 31. Furthermore, within the bill C-83, references to segregation have been eradicated and have replaced throughout by structured intervention units. As it currently stands, UCCO SACC CSN is of the opinion that the only units suitable for managing inmates who cannot be maintained in the mainstream population for security or other reasons are CSC's existing segregation units. It remains unclear whether this bill will result in actual closures of segregation units or more simply their renaming with something more politically appropriate. Regardless of where the structured intervention units are situated within federal institutions, Bill C-83 also seeks to amend the manner in which the most difficult portions of institutional populations are managed. Structured intervention unit inmates will be provided with the opportunity to interact with other inmates for at least 2 hours, as well as the right to spend 4 hours outside of their cell. While these changes are undoubtedly well-intended, they are not feasible under the current staffing and infrastructure models. Many of the inmates currently managed within segregation units are highly vulnerable and are segregated for their own protection. In order to provide them with the amount of interaction prescribed within the new bill, they will require direct and constant supervision from already limited numbers of correctional officers. Conversely, the inability to adequately manage incompatible inmates will lead to consequences like those seen in Archambault and Millhaven institutions, where inmates were murdered in separate incidents in early 2018. In general, should we proceed to the SIU model as a replacement for segregation, it's our hope that these changes will be implemented gradually, so they can be properly assessed and amended as necessary. It is promising to note that discretionary powers remain with the Commissioner to extend the proposed SIU status over 30 days, allowing correctional officers the ability to manage high-risk, volatile, or self-harming offenders without hard-cap timeframes, Section 37.4 of the bill. As with the implementation of SIUs, the ability for CSC to repurpose existing infrastructure to meet criteria of Bill C-83 is unclear. Policy changes resulting from the passage of the bill will restrict an institution's ability to respond to the needs of specific inmates, the broader population to meet its current mandate, and to provide a safe work environment for its staff. Should these changes occur, in order to continue to meet critical strategic priorities effectively, significant infrastructural changes at the institutional level are necessary. Changes proposed by the bill would allow the Commissioner to assign the security classification of minimum security, medium security, maximum security, or multi-level security, or any other prescribed security classifications to each penitentiary or to any area in the penitentiary, Section 29. From an operational standpoint, this wording appears quite vague. Historically, CSC institutions have been constructed with a security standard in mind. To attempt to retroactively change the security ratings of not just individual institutions, but areas within those institutions seems to be at odds with the original vision of them. This would significantly complicate population management strategies. The powers of the Commissioner are also broadened in relation to transferring inmates within the various security levels of their institutions. It will reinforce the power of the Commissioner to transfer inmates to different security levels. For example, transfer a maximum security level inmate to a medium security area. Given the security implications of these transfers, we feel that it is prudent to solicit correctional officers' input into these decisions, as we are most familiar with the behavior and the potential outcomes. Additionally, UCCO SACC CSN has been calling for the creation of a special handling unit for female offenders since 2005. Despite every effort, some female inmates exhibit behavior that simply cannot be safely controlled in regular institutions within the current infrastructure model. In similar instances involving male offenders, CSC has the ability to transfer otherwise unmanageable inmates to the Special Handling Unit in Quebec. Historically, due to a lack of alternative options, this has resulted in female inmates being placed in segregation for exceedingly long periods of time. However, under the new guidelines, Bill C-83, CSC may be forced to involuntarily transfer these inmates on a regular and ongoing basis in order to be in compliance with the law. The same set of circumstances that marked Ashley Smith's incarceration will become even more prevalent. This will serve neither the inmate nor CSC's legislative mandate, yet until changes to existing infrastructure are realized, they will be a necessary reality. As a result of eliminating the segregation tool, CSC will be forced to rely on managing groups of inmates through the creation of subpopulations. Effectively, they are segregating inmates without actually physically placing them in segregation. This is already occurring through the use of a variety of alternative measures. For instance, inmates are increasingly restricted to their cell or range during the day. Additionally, restrictions on when different groups of inmates are eligible to use recreation yards will become more prevalent. While these options are certainly viable, they are entirely dependent on the existence of physical infrastructure to support them. To implement these options in physical spaces, never originally designed for such purposes, elevates risk and places an unnecessary strain on staff and inmates who are living within those units. Further to the issue of infrastructure, CSC's ongoing inability to manage inmates with serious psychological issues, the ability to manage severe mental health cases out of regional psychiatric centers was already severely limited prior to the changes put forth in Bill C-83. In a 2008 report, UCCO SACC CSN is projecting a 32% increase in assaults on staff in coincidence with a 15% decrease in segregation bed use during the same period. More specifically, CSC is also projecting increased staff assaults at both Millhaven Regional Treatment Center and the Prairies Regional Psychiatric Center, which represents two of the most statistically dangerous institutions in the country. The reduction in our ability to manage the most difficult cases securely through segregation when necessary will only further exacerbate already dangerous work environments for correctional officers. And I mentioned earlier we had two inmates murdered in 2018 in treatment centers. I haven't seen that in 27 years. As we've seen in the past, difficulties effectively managing diverse populations due to lack of appropriate infrastructure can quickly turn tragic. The cases of Ashley Smith and Marlene Carter highlight the difficulties of supervising inmates with severe mental disorders and the consequences that can occur when existing policy and infrastructure fail to meet the needs of inmates and the staff who supervise them. As provincial psychiatric hospital resources continue to dwindle, along with CSC's inability to refer cases to them, federal penitentiaries across the country will be increasingly required to absorb these individuals into a system poorly prepared to address the complex health issues. This reality, coupled with the elimination of administrative segregation, will require that CSC be proactive in addressing issues around population management. Given the policy changes that have already occurred in CDs 843 and 709 and imminently in the passing of Bill C-83, we are certain that CSC will struggle financially with the necessary infrastructure changes to manage these complex offender cases. For many years now, UCCO SACC CSN has been lobbying CSC for an increased commitment to healthcare and mental health care needs. Bill C-83 recognizes the importance of healthcare professionals in managing inmates and that their recommendations are considered in the SIU assessment process, while maintaining the warden as the ultimate decision maker, section 37.2, 37.3. Unfortunately, while Bill C-83 recognizes the importance of healthcare staff in the process of managing inmates in the structured intervention unit, it falls short of specifically allocating for 24-hour-a-day healthcare services. We've been advocating for that for a number of years. This often places a burden, the burden of these specialized responsibilities on frontline correctional officers. Until recommendations for 24-hour health care made by various parliamentary inquiries and UCCO SACC CSN are implemented, CSC will continue to fail to meet its responsibilities and place correctional officers in precarious situations. With regard to UCCO SACC CSN members, while correctional officers are trained as medical first responders, we still lack access to curriculum necessary to be considered proficient in responding to individuals in a mental health state crisis. CSC is committed to expanding training to address these shortcomings. However, frontline officers have yet to see any significant changes to our national training standards. When dealing with individuals in a state of mental health crisis, de-escalation is always the primary goal for correctional officers. However, these are incidents where this is not feasible when risk is assessed, and thus immediate resolutions are required. Despite having use of force response options that include physical handling or chemical agents, we lack access to chemical restraints which are available to psychiatric hospitals dealing with the clientele whose behavior is directly comparable to the CSC inmates. While having to use chemical restraints is not necessarily ideal or to be relied upon as the only option, their inclusion as a response option could preclude using physical force, thus allowing safer resolutions for staff and inmates. With regard to preventative security, we're encouraged to see the inclusion of body scanners. I had mentioned that earlier, and again, we've supported that since day one. There is ample evidence to support the detrimental effects of long-term segregation can have on inmates housed in such conditions, and that some inmates may have pre-existing conditions where placement in segregation could further exacerbate their health issues. While UCCO SACC CSN recognizes these studies and their findings, our members work in an environment where mental health issues and self-injurious behaviors are exceedingly common. The Office of the Correctional Investigator has estimated that mental health problems are 2 to 3 times more prevalent in federal institutions than in the general public. In order to meet our mandates of safety, security, and rehabilitation, we cannot be left to operate in a state of ambiguity. Such, should Bill C-83 pass, it is our sincere hope that careful consideration be given to how it will be implemented. As we have seen recently, too much change too quickly, without consideration of its impacts on our environment, leads to people being seriously injured or worse. We would make the following recommendations on the bill. We're asking for number one, a more robust reassessment of policy changes that are going to influence Bill C-83. The implementation of a more robust incident tracking system to better understand the operational impacts of these changes. The reversion of language that now recommends response options be least restrictive to what was previously most appropriate. A commitment to supplementing existing infrastructure within federal institutions in order to address the impacts of elimination of administrative and disciplinary segregation. A review and augmentation of the disciplinary system must occur prior to the elimination of disciplinary segregation in order to effectively respond to the most difficult behavioral inmate cases. A commitment to the availability of healthcare professionals 24 hours a day within all CSC institutions. The expansion of alternative response options such as chemical restraints similar to those used within provincial psychiatric hospitals. The supplementation of existing training and the implementation of new training to provide correctional officers with additional tools to allow them to safely respond to the diverse needs of inmate populations. De-escalation training would be very useful. Increased inclusion for UCCO SACC CSN in future discussions regarding structured intervention units and recognition of correctional officers as partners and subject matter experts. A more detailed explanation of the structured intervention units and the proposed operational guidelines. The continued availability of existing segregation units until such time as it's mutually agreed upon to move forward with the other units. In closing, UCCO SACC CSN recognizes that changes to strategic priorities, adapting to emerging trends in corrections, and the operational policies are a reality of our work. However, including our members in conversations around these changes prior to their implementation is critical to ensuring their effectiveness. CSC and the government issuing its mandates needs to realize that changes to these policies can substantially increase the potential for volatile situations within its federal institutions, which will directly impact the safety of staff and inmates. Accordingly, we hope that you will take our concerns into consideration and allow us to work as partners moving forward to ensure that the best possible outcomes are achieved. Thank you.
Thank you.